Dr. David A. Asch has engaged in out-of-the-box thinking that has elevated the standard of healthcare delivery in America. A prolific scholar, he has informed federal policy with his work on end-of-life care and genetic testing. Today, as Executive Director of the Penn Medicine Center for Healthcare Innovation, Dr. Asch and his team continue to transform care by developing creative and evidence-based models that improve common clinical interventions like scheduling and hypertension management.
We have this paradox in healthcare where it seems like every day we're introduced to astounding new discoveries, CRISPR gene editing or CAR-T cellular therapy for cancer. And at the same time, we hear complaints, why can't healthcare be more innovative? And I think the resolution of that paradox is that when people are calling for healthcare to be more innovative, they mean more innovative in the delivery of services, more innovative in the organization and financing of healthcare, how we treat patients as customers, or even how we treat our physicians and nurses. And it seems crazy and forced and maybe a little irritating to think that a place like Netflix has something to offer to obstetrical care, or IKEA can offer something to hip replacements. But if you take a step back, it's actually not crazy to think that IKEA, as a business model, might be able to help us. So for example, IKEA has been great at thinking about returning to the customer all of the aspects that the customer himself or herself can do. You pick up the product yourself, you take it home, you put it together yourself, and the company, the factory, does only the things that the customer can't do. Well, maybe that's not such a bad model for hip replacements. Maybe we actually can learn from other industries and transport elements of their business delivery models and introduce them into healthcare. No matter how effective a drug is at treating a disease or a vaccine may be in preventing it, both require a physician to prescribe it and a patient to take it. And we have a lot of room for improvement on both of those fronts. Human behavior sits as on the final common pathway for so many of our advances in health and healthcare. And only now are we really beginning to invest in the science of human behavior to make healthcare better for all Americans. So I've been so fortunate to work in an area where clinicians and scholars recognize the value of using science to inform health policy. So I'm often asked, what can I do as a clinician or a scholar or a scientist that will be important? My answer is pretty simple. Vote. It's important. There's so many people to thank, but really I'd like to single out some people who sit at the intersection of, one, they will see this video, and two, they will be setting my salary in the future. So Larry and Ralph, thank you. I couldn't have done it without you.